changing some things, eventually moving to a different nose piece, but that'll be a little while because you have to reconfigure some of the parts when you have the equipment.
Right.
So we have 4 nitrous units. So I'm just going to go over how to set it up because as dental assistants, you're not going to be regulating it. You can reduce it if you have that credential, but you can't increase it, so the doctors are going to take care of that. So we have 2 units here, and those are probably the ones you're going to be using. Over here in this cabinet, there's a key, and Nadine can show you where the key is to unlock that cabinet. And we have 2 on the other side. The students won't be using the nitrous until January. So, I mean, I don't know why you would need more than 2 units, but sometimes the students are using these units. They do have a sign-up sheet that they use when it's their time to start using nitrous, and so it would be helpful. We'll try to make sure that it works so that you guys can use them at the same time as students, so they're not signing up for one. So the 2 main things, the reason why I brought out 2 pieces of units, 2 units here, is because they're a little bit different in that this particular unit is always a bugaboo to everyone because it has the scavenging regulator on the unit right here, as opposed to this particular, and the other 2 have a scavenging gauge on the tubing. So that confuses people because sometimes when this equipment gets put away, by the way, this will slide up, which is what you want to do with this so that the bag has room to breathe. And then you can tighten it so it stays up, but it has to go back down when it goes in the cupboard, obviously. So as you look at the side of the unit, you'll see these 2 words, mask and vac. Okay, so there should be 2 tubes there. Sometimes this tube is like stuck here. I've seen it stuck here. I've seen it like, I don't know what this goes to, but it goes right here where it says mask, okay? Because the end of the tubing goes to the conduction tubing, which is the mask, okay? There is no, the other end of it is what goes on the scavenger, which is the high-speed suction, okay? So the chairs that are, these 3 chairs here that the doctors normally use have 2 high-speed evacuation lines, so you can use your high-speed suction and nitrous at the same time, okay? These units here only have 1. So if you're gonna be using nitrous in any of these chairs, what you have to do is connect your scavenger up to an adjacent chair and hope that's not in use, okay? Which I don't think it happens. I mean, if you guys are, okay. So to set it up, so if you know your patient is going to need nitrous, you can set up the unit before they even come back into the operatory, okay? And I would suggest you do that because you need to open up the tanks and connect the tubing. Which can be a pain if you're not used to it, okay? So the tubing will be packaged up like this, okay? In a sterilization pouch. We sterilize the conduction tubing and we sterilize the scavenging nose piece or mask piece connector. And we tape it on the outside of the packaging because they melt when they go inside, okay? The conduction tubing needs to be rinsed with water and never used any disinfectant on it because the disinfectant can break down the tubing. So what I find is best when you're done with it is to rinse it off under some running water, and the sterilization area is fine because you're going to put it in a bag, coil it up carefully, and then take the nose piece. These are about a $50 part, so when you throw them away, then we have to replace them. So be very careful not to toss those, and then package them like that, and then they should go on the middle rack in the sterilization area, okay? When you're setting up, you're gonna pretend like I have gloves on, okay? We're gonna put on clean gloves because you're gonna touch this conduction tubing, and that's what's gonna be part that's gonna be in contact with the patient, so you don't wanna be handling it without clean hands or gloved hands. Nose pieces, we have scented and unscented. Most people are gonna be a size medium. If you have a really large person, someone with a really large nose, then you might wanna use a large one. If you're not really sure, what you can do is you can take off the wrapping with gloves on and put it in a Ziploc baggie to have the patient try on. And then if for some reason it doesn't fit them, then you can at least put it back into a bag and we can reuse it. Otherwise we throw these away, okay? Because they're not reusable, okay? To connect it, I'm gonna take a step back and show you setting it up. So usually I set it up over here because I'm a right-hand clinician, I'm working by myself, but you guys are working 2 people on each side, so you're more than likely going to set it up right here. It needs to be within the view of the clinician that's doing the induction, okay? You also need to open up the tanks. So once I kind of get these all set up here, I'll lay the tubes here while I'm waiting. And then I'm going to open up the tanks. Now, there are instructions right here on how to prepare the tanks. They're on every single unit. Maybe you can show us here if you want to. And it says beginning of treatment. And it says after treatment. So there are instructions to follow if you forget this process, okay?
They actually worked.
And they actually work, okay?
Yeah.
So there are 2 oxygen tanks and 2 nitrous tanks on each carriage. One should be full and one should be in use, okay? Now, for some reason, the company here decided, see these both, one says empty, so somebody didn't change this one. This one says in use, so you should have one full and one in use, okay? When you're done, I'll show you how to change the, when we're done, I'll show you how to change the tanks. But for whatever reason, they decided to use a special label on the oxygen tanks, but they decided to not give us a special label on the nitrous tanks, okay? So we use a post-it system, full, and nothing. So I'm assuming that is in use or empty. We'll have to figure that out, okay? So when you have to go to the in-use tank, which I'm going to assume this one's full just for our training purposes here, and you need to open the tank. You always open oxygen first, and then you open nitrous, okay? There's a safety mechanism in the system that allows you to not run nitrous unless oxygen is on. But so nitrous can't push itself out of the system. You have to have the oxygen on. So when you're closing the system down, you do it the reverse, and I'll show you that when we're done here. So key here, rotate counterclockwise, lefty-loosey, and you only need to rotate it a couple of turns to get the gauge to go up, okay? And then we're going to assume that this one's got gas in it right over here, right? This is our, well, we'll see. Let's check this out over here. This is our in use, right? Sorry, tubing here. This should go up if this is in use. Yep. So it's, my guess is it's full because it says 750, but I'll go ahead and leave them open. I hear a little bit of a hiss, and it might be because there's an O-ring that needs to be changed, and we can change that out. Okay. So now they're both connected. So this is all set up, ready to go in your position, and then you can connect your conduction tubing and your scavenger. The scavenger will go here. This is a kind of a funky one. You want to make sure that this has a curve to it and it's not kinked, okay? And it just goes in there, and then you can turn your suction on to see if it works. You're not going to hear a lot, okay, until we turn the gas on. But sometimes, because this one wants to kink, I'll turn it upside down like this and it'll still work.
That's a good one.
So you can just slide it in there. Whoop.
Not in the way.
It's not in the way because you don't really need it, but it just needs to be connected. So, but it's up to you, because sometimes for you guys it's going to be, you're going to be bumping up against it, and it should be under the plastic. So I know you guys don't like to open the whole thing up because
some of
it's a
us do.
sleeve, but what you can do if you're like, if you think, because this isn't really big enough, just tear it.
Yeah.
And then it's big enough to drape over, okay? That way it works better, okay? Then you have a bigger one, okay? And then the conduction tubing, it came off. You connect that.
Yes.
Oh, hello. So big and small, and you can see it has a little bend on it, so you want the bends to be next to each other, and then have this be away. And then you connect the tubing. You can see there are small holes and large holes. You connect the small to small on one side, and the large to the large on the other side. Then you take your scavenging hub and connect that to the flexible tubing, not the adapter. And the adapter goes in. This will be my demo nose piece now. Goes in here. And then this part here is where the scavenging happens. That's a little like flimsy diaphragm, and it should connect right in there. Okay. And I always check it. It's supposed to slide in. It's kind of funky. Make sure that it's not impeding on the diaphragm. It's not pinching the diaphragm. If it gets disconnected, just plug it back in there. Okay. And then I'll drape that, and then I'll get a barrier. I'm gonna just grab the barrier from here. And you need to have a barrier over the whole unit, okay? Because if the doctor is using, or the clinician is adjusting the nitrous, they will need to be able to do it without cross-contaminating equipment, because we can't disinfect any of this tubing, okay? It all has to be kept clean. And so I'll just take this tubing and sometimes just lay it over the top of this because it's on a bag. Okay, let's keep popping out there. And then it's ready to go for your patient, okay? When your patient comes in, and this is something that you can do to help the doctor out, is that it's required by law for us to do some documentation. So in the auto note, there is a template for you, and you can insert it into your notes. So if you have a note already open for a procedure you're performing, and you want to put that auto note in, you can insert that auto note right into your note. And then all of the information that you have to record pre and post is in there. And so it'll give you some prompts. You need to get an informed consent from the patient.
The blue one, yeah, right there.
That's this one here. And this is just informing the patient of our rules and policies. The patient has to sign and date it. And we have no clinicians here. I don't know if Dr. Beakey does, but no clinicians that have a permit to provide sedative with nitrous.
No.
So
Nobody
patients
does.
cannot be on that. And so the other thing that there are certain medications that the patients cannot be on. They cannot have smoked marijuana or use CBDs within 72 hours. So you need to ask them, okay? And if they don't want to give you that information and you suspect that they are, then you need to explain to them why, because they will become over-sedated with the nitrous, okay? So they have to sign this, and when they read it, they'll see that there's a notation there about marijuana use, okay? Yeah, benzos.
Oh, and then,
Yeah. It's, so it says here, I understand that my dentist or hygienist must know that if I have taken any type of medication or drugs, prescription or recreational, including marijuana, within the past 72 hours. Okay? And they sign it, so. And then in the auto note, there's a prompt to do this informed consent. Also, you have to document why the patient is using nitrous, anxiety, whatever the reason is. And then you have to do pre vitals, blood pressure, pulse, and respirations, and then write down what their ASA status is, okay? And then once you've done the nitrous, you need to keep track of how much time they're on nitrous. You need to keep track of the total tidal volume that they have. So if you don't know that, what I would do is get a Post-it note and just jot it down during the procedure so that you have it, and then you can write the notes afterwards, because the doctor will be taking care of that. But you'll need to check with them and ask them, how long were they on it? What was the total tidal volume, and what was the percentage? It's up to the dentist's discretion on how they want to manage and doing the induction. We have a certain way that we have the students do it, but you know, they're responsible for how they do the induction. But as long as you document everything, then you're good, okay? And then when they're done, after the 5-minute post-oxygenation, after the procedure, after they're off the nitrous, then you need to do post-vitals as well, and then you need to document that they're responsive, talking, they're ambulatory, they're not dizzy, that they're ready to go. Most people aren't. They usually don't have a problem with it, okay? Yep, so that's the notes for that. Now when you're all done, Susie Q's done, we've done the procedure. Oh, one other thing, protective eyewear even with nitrous. I know it's kind of annoying with the nose piece to have that, but they have to have protective eyewear, and you want them to have protective eyewear that you can see their eyes, okay? No dark sunglasses.
Yeah,
Okay?
That's very good.
Yeah. And there's extra ones on the other side, or if you want to put some glasses somewhere and label them nitrous so that they're always your nitrous glasses, then you could do that too. Okay. Okay. So when we're done, we're going to take apart the tubing. The nose piece gets tossed, and then this gets packaged, or excuse me, that gets tossed. Now, when you take this apart, these connectors need to stay with the equipment, not with the tubing. And I already found another unit that's missing. Did you
Yes.
find the part?
Yes, they brought it to me and I was like, I think this goes on
Yeah.
the unit. She's
If,
like, I don't
if you
know.
can find it, let me know, because I
It should've
found
gone through
I found the
sterilization.
equipment.
Don't you turn all that off first and then
Oh
you
yes,
start?
I'm sorry.
Okay.
Thank you. I need to flush everything out.
Okay.
Well, you can do it with this on there, but
I just didn't know what
yeah,
this.
you're right. Thank you for reminding me that. I got sidetracked. You can do it with just that on there, but it's ideal to do it this way.
And I recommend, like, when I help the students shut it down, I go step by step.
Yep.
I
On
just
the
look at that
instructions,
yellow
for
and
sure.
I just go step by step, cause you think you remember,
Yeah.
but you don't.
Mm-hmm, that's good.
And if you don't shut off one part of the other.
There's no reason.
Yeah.
There's nothing wrong about reading the instructions again and again and again and again, because you'll forget it. Yeah. So we're all done. Now, when we want to bleed out these lines, because if we have to change these tanks, and the gas connects from the tank into the gauge, and there's still gas in there. So if I were to take this tank off, even though I've shut this down, if this isn't down, this gauge isn't down, then I still have gas connecting, and I'm gonna hear a loud noise that might scare me. I don't want to get scared. So that's dirty. Now, to turn them off, this is a cheat sheet. Here it is. So our instructions say, with the oxygen and nitrous on the unit should be attached to the scavenger, okay, and scavenger on. Shut off the nitrous tank first. So we're doing it the reverse. So oxygen and then nitrous to turn on. Now we're doing nitrous off to oxygen off. So when I turn these on, now I have to actually turn these on, because you're not gonna have any force to push that gas out. So I'm gonna turn this off to the right, and you'll see the gauge drop right here.
Mm-hmm.
And you'll also see, whoops, around the other way here, the nitrous ball should drop. There it goes. And then I'm going to turn the oxygen one off. Which one's am I going to use? This one here. And that gauge will go down. And for the oxygen, you can even press the flush to make it go faster. Okay? Otherwise, it'll just kind of want its way down. Okay? Now I can take the tubing apart and change my tanks if I need to. Okay? And put the equipment away. Okay? Now for the tubing, you're going to rinse this with soapy water in the sink. Soap's not going to hurt it. It's mild. And because see, what happens is you get like this fuzz on here, people's hair, their fibers from their clothing, and it's just this icky. It gets sterile, but you want it to be clean. And then we're going to coil this up. There's some really large sterilization pouches, and then you're going to package it like that. Okay? Any questions about the setup?
It is.
So I want to show you how to change tanks. So we're
Okay.
going to go over to where now here's the
I'm
thing
gonna
about
do a
tanks.
separate video on